Okay, so I've been a speech pathologist for just on 30 years now. So I've worked in many different areas of speech pathology, but always within paediatrics. So I've worked in early intervention centres, I've worked in the school setting, and that's been the state system, the independent school system, the Catholic system. I've worked in private practice, I've worked in, as I said, community health centres as well. And I just love and adore working with children, and more particularly working with the families. Child language impairment. And so that means a child who is having difficulty following instructions, being able to understand what is going on around them, and then being able to then express themselves. I've worked a lot in the area of disabilities, and so I'm partly involved with special schools, and I have particularly been involved with children with autism spectrum disorders, but also a variety of other children who have got other issues, be it various syndromes or various health impairments. Sometimes that means that a child will need a lot of support for their oral language, so they may need some additional assistance with visual communication systems. Boardmaker is one of those, and perhaps also signing. Well, when a family comes to see me, I want it to be fun. I want it to be fun for everyone, because obviously if a child is going to want to come here, we are hoping that they will develop their language skills and their clarity issues, but they need to be able to have fun, because if a child isn't having fun, then they won't want to be here. So when it is fun, it will be very directed fun though, and so it's via the games and the activities and the play that we will be really targeting specific constructions or specific concepts that the child may be struggling with. I think that the fundamental part of what I do is that I don't have a magic wand. I'm here for half an hour a week, an hour a week sometimes. Sometimes it's 45 minutes every 2 weeks, whatever is the best scenario that can be managed by the family. But the thing about it is that I will show the parent how to be the agent of change. And it is through my guiding the parent or the carer or the grandma or the auntie or whoever it is that we are able to bring about the best outcome for their child. Oh, I wish I had some money for every time this question got asked. A parent should bring their child when they get concerned. Most parents have a great perception about whether their child is struggling or not. But sometimes in busy lives, things can get overlooked. So when a childcare worker, the maternal child health nurse in particular, is a great source of input and information. So when a medical professional, a childcare worker, or a teacher, or a preschool teacher mentions some area of concern, then I would automatically follow that up. But basically follow your gut instinct, and if you feel that you just want to be sure that where your child is heading, come and see us. Oh, okay, well, I have 4 children of my own. That's often a fun fact. But I just love sport. I love sport, and because a lot of the kids who come here are little boys, we usually get on really well in relation to that sort of thing. I love the Richmond Football Club, I love cricket, I love anything to do with sport, and therefore living in Melbourne suits me very well.